Hello, welcome to my presentation. My name is Coy Allen. I'm an associate professor at Virginia Tech. Today we're going to be talking about establishing a novel pig model of human cancer for therapeutic development. We're going to be focusing on a pilot study conducted with pancreatic adenocarcinoma. I would like to start out by thanking the organizers for providing me with the opportunity to share my work with you today. No other common malignancy can match pancreatic cancer in terms of its rapid progression and near inevitable lethality. Surgery may cure patients with stage 1 disease. However, more than 75% of patients will present with borderline or unresectable disease. Chemotherapy and radiation treatment protocols result in limited response rates and are rarely curative. New therapeutic strategies and paradigms are direly needed. Over the last decade, several thermal ablation strategies such as radiofrequency, microwave, and cryoablation have emerged as promising therapeutic options for pancreatic cancer. However, the vast majority of these tumor ablation modalities have been developed for pancreatic cancer using models based on data generated from healthy tissues, rodent models, and occasionally spontaneous tumors in veterinary patients. While these have been really useful to move technologies forward, all three of these approaches have specific limitations. For example, healthy tissues do not reflect the biological and physiological changes that occur within the tumor that can have significant impacts on the ablation of the tissue. Rodent models have issues with scale and clinical relevance. Also, the scale up on the engineering side is also required to make devices for both rodents and people. Spontaneous tumors in veterinary patients are limited due to the severity of the disease. Similar to human patients, the cancer moves so quickly following diagnosis, it's difficult to effectively treat. Thus, the lack of clinically and physiologically relevant preclinical pancreatic cancer models is a significant limitation. To circumvent this issue, we have developed a novel immunodeficient pig model. These animals lack RAG2 and IL2RG, and these have proven ideal for human cell transplantation and xenograft studies. As seen here in the first figure of our poster, we utilize CRISPR-Cas9 to effectively target the RAG2 and IL2 genes in pig embryos. This gives us the ability to generate these animals on demand without the need for expensive breeding colonies. Modified embryos are transferred to surrogates, gilts, and when born, all animals have deletions in the RAG2 and IL2RG gene that results in an immunocompromised state. We found these pigs to have similar features to their rodent counterparts and often parallel studies using non-SCID gamma mice. As shown in figure 2 and here on this slide, regardless of the genotype, we also phenotype these animals prior to utilization using flow cytometry to evaluate the immunocompromised state. So we next wanted to evaluate their ability to engraft with human pancreatic cancer cells. Because these animals lack RAG2 and IL2RG, we have found that they are excellent hosts for human xenografts. In initial proof of concept testing, we evaluated engraftment efficiency for human pancreatic adenocarcinoma cells, the PANCO1 cell line, which are shown in figure 3. Initial studies utilized subcutaneous injections in the pig's ear, which is shown in figure 4. This allows us easier access to the tumor for monitoring. It also allows us to evaluate engraftment efficiency. Due to the size of the pig, we can also generate multiple tumors per year that are larger than we can in mice. This allows us to rapidly generate tumor tissue for ex vivo and in vitro modeling studies with tumor ablation modalities such as HIFU and histotripsy. As shown in figure 5 and here, histopathology was compared between the PANCO1 human pancreatic cancer cell lines in the pig model, the PANO2 mouse pancreatic cancer cell lines in mice, and PDX tumors generated directly from patients that implanted into non-SCID gamma mice. As expected, the PDX tumors have the highest level of physiological and clinical relevance compared to actual human pancreatic cancer. The mouse PANO2 model is highly homogeneous in terms of the cells present and minimal relevance to human patients. The PANCO1 tumors in our pig model were an intermediate between the PDX and PANO2 models with some features of each. Here we also conducted immunohistochemistry of the ductal marker CX19. This revealed duct formation in both the PDX tumors and the PANCO1 human tumors in our pigs, but not in the tumors from the PANO2 mouse line. As shown in figure 6 and here in the slides, moving beyond our proof of principle, proof of concept testing, We have been advancing towards orthotopic tumor placement in the GI tract and pancreas. This involves not only model development, but also optimization of our treatment modalities such as HIFU and histotripsy. We've been successfully generating a number of orthotopic tumors from cell lines, PDX tissue, and even direct tissue from patients in our immunocompromised pigs. These tissues tend to faithfully recapitulate all of the aspects of the tumor microenvironment, with the exception of the immune system niche. Moving forward, we're beginning treatments of these tumors with our various treatment strategies and look forward to incorporating this model across tumor ablation modalities, right now especially focusing on histotripsy. I'd like to thank the Focused Ultrasound Foundation for their support of this project and for the amazing work that they do. We'd also like to acknowledge the Virginia Maryland College of Veterinary Medicine, the Virginia Tech Institute for Critical Technology and Applied Science, and the Center for Engineered Health for their continued support. We'd also like to acknowledge the various funding institutes at the NIH that continue to support our research programs. Thank you for your time.